Equity has been one of our True North goals for ZSFG since 2017. We've been very focused on figuring out how we can put programs in place to reduce the disparities we know are present throughout healthcare.
Any behaviors that pose a threat to our staff, then the immediate response is to call for security. And our sole security provider during that time have always been law enforcement. And so we have law enforcement responding to these situations, primarily being patient care situations.
My name is Joan Torres, and I'm the nurse manager for the Behavioral Emergency Response Team, also known as BERT. At ZSFG, we saw that clinical staff didn't have additional resources to contact if a patient was having a behavioral emergency. For example, they might be in pain or unable to verbalize how they're feeling. That frustration may come out as destroying property or breaking objects. When that were to happen, the primary teams only had the sheriff's department to contact for additional support. With BERT, we're a resource here that's all clinical. So if there was some kind of emergency or crisis, we're here with clinical staff that are trained in psychiatry and behavioral health to help support the patient undergoing that crisis.
Before we had BERT, we knew that we were using force too much on campus. And further, we knew that we were using force disproportionately with Black men. And that, of course, was very troubling to us. So that was one of the many reasons that we wanted to put BERT in place.
In most cases, the BERT is able to respond to, I would say, 80% of their incidents without the need or presence of law enforcement.
I don't think most people come into the hospital wanting to act out. They just become frustrated because of their situation they're in. So they're dealing with all kinds of stuff. So if we can make their stay here just a little bit better, help them feel more acknowledged, I consider that to be a kind of a good work day, you know.
The BERT team has been amazing. Before BERT, there were all kinds of situations that were unsafe or scary or unpredictable or labile. And as the nurse there, the first one who meets someone who's having a mental health problem or a behavioral problem, I'm obligated, and it's my job, I choose to work here, to go into that room. And with BERT now with me, it's just so much better and so much safer. They're really good at approaching patients and de-escalating and helping me with that aspect of it so I can do my job, which is the medical care part. And I just love them. It's just been such a help.
I found our environment becoming slowly more threatening to a lot of our staff and to our providers. And largely that has to do with a lack of social resources to help support our patients, be able to survive and thrive in our communities. And I feel by having allyship with groups like BERT is the way of the future.
It's nice to be able to see the changes that we had within our organization to really come from not having a resource that's available to our patients throughout the hospital for their behavioral health needs to now having a service that's available 24/7. Staff really feel comfortable in contacting BERT for additional support and really see the change that we had when we first started off, when staff were kind of weary to contact our service, to now really feel comfortable in contacting us as that first resource.
Joan is an outstanding leader. I remember talking with her and working with her when BERT was a tiny pilot project, and it was so great to see her curiosity about how the program was developing. Her use of data has been outstanding all along, and just her persistence and resilience with a program that people didn't really understand at first, but now have grown to love and really rely on. I don't see how we would operate on a day-to-day basis without BERT at this point.